Medicare Part C. This is a video comparing traditional Medicare to Medicare replacement plans. As a brief overview of Medicare, there are Parts A, B, C, and D. Medicare Part A covers hospital or facility charges. Medicare Part B covers professional or doctor's charges. Medicare Part C is an external insurance that replaces traditional Medicare. And Medicare Part D covers prescription or pharmaceutical charges. But the question many people have is Medicare Part C worth it? To answer that question, the top 3 companies that offer Medicare Advantage plans were reviewed with the common benefits they provide. But keep in mind, the benefits explained in this video do not apply to all plans within that company. Let's first start with premium costs. For traditional Medicare, if you have paid Medicare taxes for at least 10 years, then Part A should cost $0 a month. If you have paid Medicare taxes for less than 10 years, but greater than 7.5 years, then Part A may cost around $311 a month. But if you have paid Medicare taxes for less than 7.5 years, your monthly cost for Part A may be around $565. And Medicare Part B is at an average cost of $202.90 a month. Most people have paid Medicare taxes for at least 10 years, so the average cost of having traditional Medicare should be around $202.90 a month. The top 3 most popular Medicare Advantage plans come from either Aetna, Humana, or United Healthcare. The average premium cost for Aetna is around $241.89 a month. The average premium cost for Humana is around $229.78 a month. And the average premium cost for United Healthcare is around $236.80 a month. So having a Medicare Advantage plan may cost somewhere around $25 to $40 more a month. In terms of benefits, traditional Medicare has a set annual deductible. This changes every year. For the 2026 year, the deductible is $283.
Be sure to watch the video on Medicare supplemental plans about what plans cover Medicare's deductible.
Once the deductible has been met, Medicare covers all services at 80% coinsurance. This leaves a 20% patient responsibility with no out-of-pocket maximum costs. In comparison, Medicare Advantage plans generally offer copays, deductibles, and maximum out-of-pocket costs. But before you decide to sign up for a Medicare Advantage plan, let's do a real-life scenario of what these differences really look like. In order to do this, specific services were reviewed based on the Austin, Texas Medicare fee schedule. I chose this location due to its high population. So let's start with doctor visits. A visit to your primary care doctor will be cheapest with a Medicare Advantage plan. They offer a small copay or no patient cost at all. In comparison, you may be looking at paying about $40 with traditional Medicare. But if you need specific medical treatment by a specialist, the average copay with Aetna is $55, Humana $35, and United Healthcare $40. In comparison, traditional Medicare applies the same cost to a specialist as it does with primary care doctors, the cost still being around $40. So there's not a big difference in cost between traditional Medicare and Medicare Advantage plans. But let's say you need emergency services. An outpatient hospital visit with a doctor may cost somewhere around $125 with a Medicare Advantage plan. With traditional Medicare, it will only cost you $30. And if you go inpatient, a visit with the doctor may cost somewhere around $110 with a Medicare Advantage plan. With traditional Medicare, the balance will be around $20. So the results show if you tend to be mildly sick and only need primary care, Medicare Advantage is the best for these. But if you tend to be sick or have occasional emergencies, traditional Medicare has the best coverage. Now let's look at preventative screenings. To use an example of preventative screening, let's look at colorectal screenings, since that is a service almost everyone has at least once in their lifetime. Aetna, Humana, and United Healthcare apply a small copay for these, ranging between $20 to $55. In comparison, traditional Medicare may leave a balance of about $100. Once again, this shows Medicare Advantage plans have the best coverage for wellness-type services, like preventative screenings. Now, let's say you are very sick or injured. In many cases, the doctor may order imaging in order to evaluate what's happening in your body and come up with a treatment plan. Let's start with a simple X-ray. A chest X-ray with Aetna or Humana may cost about $35, but an X-ray with United Healthcare may be covered at 100%. In comparison, traditional Medicare may leave you with a balance of about $7. For an MRI, Aetna, Humana, and United Healthcare apply very large copays. Having an MRI may cost you $260 to $330. In comparison, traditional Medicare may leave a balance of $66. As a result, traditional Medicare has the best coverage if you've become really sick or injured and need imaging to determine what's going on in the body. So let's apply this to a real-life scenario. Let's say your leg is swollen and tender to the touch. You visit your primary care doctor for treatment. Your primary care doctor refers you to a specialist. The specialist examines your leg and wants to rule out the possibility of a blood clot. The specialist orders a CT. If you have Aetna, your premium cost may be $241.89. You pay $0 for your primary care, a $55 copay for the specialist visit, and $285.88 for a CT. In that month, you paid a total of $582.77. If you have Humana, your premium cost may be $229.78. You pay $0 for your primary care, a $35 copay for a specialist, and $280 for a CT. In that month, you paid a total of $544.78. If you have United Healthcare, your premium cost may be $236.80. You pay a $20 copay for your primary care, a $40 copay for a specialist, and $260 for a CT. In that month, you paid a total of $556.80. And if you have traditional Medicare, your premium cost may be $202.90. You pay $39.42 for your primary care, $39.42 for a specialist, and $57.17 for a CT. In that month, you paid a total of $338.91. So is Medicare Part C worth having? If you are generally healthy, then yes, having a Medicare Advantage plan may save you money. But if you tend to have doctor visits often, then you may want to stick with traditional Medicare to save money. But an argument can also be made that an Advantage plan covers Medicare Part D, so this is your primary reason for choosing an Advantage plan. If you would prefer to stay with traditional Medicare, please review 4 popular Part D insurances comparing prices of 4 common drugs. Review and decide for yourself. Like and subscribe if you found this information to be helpful. Please comment any questions or stories below. Thank you for watching.